Welcome everybody to yet another GW Center for Integrative Medicine virtual open house. If you are not watching this live, but this is a recording, today is July 21st, and this open house is about our cognitive reversal program. So the way we're going to do it today, I will give an introduction to what ReCODE is, what the program look like. I'm going to also introduce our staff, and actually I'm going to review at the end of my slides, I'm going to review who is doing what, and then each practitioner involved in ReCODE is going to give a couple of minutes presentation about what they do, and then we should have plenty of questions, plenty of time left for questions. So without further ado, I'm going to go ahead and share my screen and gonna put the slides on. So at this point, we actually at about 60 patients, actually just a bit over 60 patients. This was presented at most recent Academic Consortium of Integrative Health Centers conference in Chicago. So it's a little bit outdated just by about 5 months or so. What is the program itself and what are we actually talking about? So background here, back in about mid-2010, so something around 2015, Dale Bredesen first came out with this nomenclature for different types of Alzheimer's. And the idea here goes like this. We always assumed that Alzheimer's is a pathology and that the path to pathology has particular physiologic parameters and there are triggers or there are risk factors, but it was never really categorized in any standardized way of looking at it, with the idea that when you adjust these factors, when you correct them, when you fix them, that you can actually not just slow down the progression, but reverse it. So back in that time, this was the causes were described in the big categories, and it's still done the same way. And the importance of these categories is that this is how we treat. So if you look at the actual program and actual process, we divide it in broad categories. And as you will see, as we go through the slides and also as we go through our practitioners, you will understand why each component has a particular team set up how to deal with this. Because as you can imagine, for example, addressing something like toxicity, especially if it's a mold toxicity, may be extremely complicated matter to the point where, as Dr. Yekel has, has a whole separate program which requires a monthly visits and very complex treatment protocol, which he's going to review briefly. So kind of forward down to late 2018, this was the first 100 of cases that were published through the Apollo Health, and subsequently Bredesen now has 3 different books. And this first 100 of cases included 3 cases from our clinic, and subsequently, I'll show you in a minute, we actually now have a controlled study that was finished a year and a half ago and recently published. So I'm going to show you the results. So this was 25 patients who had an early Alzheimer's disease. There was no control. So somebody is not muted, if you don't mind muting yourself. So this was 25 patients who were recruited at one particular center, and they were all received a complex treatment, which we'll review in a second. And the results, and all of these patients had Alzheimer's disease, and they had scores of MoCA, it's a standard assessment, 19 or higher. And after 9 months of the protocol, what happened is that 84% of patients roughly improved. So all but 3 patients got better. 2 patients declined significantly, 1 moderately, and 1 patient had no change, so stayed stable. And those of you who are familiar with Alzheimer's disease, quite well aware, so you will never expect even 1 patient to improve. So this was a pretty dramatic result. To give you a comparison of the FDA-approved medications that just came on market in the last 2 years, there is 0 improvement, none. And there is only about 5 to 10% stability, and the rest just progress slower. So in contrast to the drugs, this is dramatic results. You, of course, have not heard of this from Washington Post, New York Times, and all of that, just because the approach here is so dramatically different. It's not patentable, and you really can't, from pharmaceutical industry, cannot make any money out of this. And so this is the data. So this is the actual overall data from about 2 years ago, from about 250 patients that are more pragmatic data, meaning that this is just an assessment from Apollo Health. When you're looking at all comers, some of these patients have not gotten all the required treatments. Some of them have not gotten genetic tests. Actually, probably majority have not gotten genetic tests because of the cost. Genetic tests are almost $2,000, so it's quite expensive. But nonetheless, you can see that 50% improving, and then roughly a quarter getting worse, and the rest are kind of staying no change. So, and I'm going to actually ask my staff, if you guys don't mind, letting people in and muting them when they come in. So what is the protocol itself? It's very complex dietary change. You're required to be either on ketogenic diet with lots of vegetables. In patients who are unable to tolerate ketogenic diet, patients can be on Mediterranean diet. There's a required intermittent fasting at least 12 hours, preferably 14 or 16. And then there are a number of therapeutic foods listed here. Everybody's supposed to be doing not just physical exercise, but cognitive training for about an hour a day. There's a very complex protocol of supplementation, very complex adjustments of hormones, which we will separately discuss. Everybody required to undergo sleep tests, as well as correcting any sleep abnormalities, even when they're mild. Everybody have toxicity assessment, whether it's heavy metals, molds. When we find those, there's a very complex detox process. And then everybody obtains some kind of a neurostimulation. At the moment, we're using infrared light as well as 40 hertz light. Primarily, we're switching to 40 hertz light and sound, especially given that we just published very positive study this past week, which I will discuss at the end of my slides and also in the question Q&A section. So in addition to this, we actually are assessing a number of other things that are not described in the original ReCODE, and that does include gastrointestinal comprehensive studies, as well as a number of other things, such as doing specific neurologic assessments, hormonal tests beyond listed here, things like cortisol, for example. So, and moving on, so this is our data as of early 2023. So at that point, we had 61 patients. So we have much older population on average. If you take all of the patients, kind of a close to age of 80, which is almost 10 years above the average that was studied by Bredesen group, which is probably why we're not seeing as spectacular results. We only have about 30% of patients who are improving, 30% or 25% staying stable, and some progressing. Now, notice that nearly half of the patients are unable to maintain on protocol for 12 months, which is a requirement for us to sort of continue. And the reason for that is it's a very expensive program. You know, it's thousands and thousands of dollars. The most significant cost of the program depends on the dental work in the year one. So if you require removal of multiple silver fillings, if you require those to be either put as a crowns or even implants, potentially that leads to quite high first year cost. But even without dental work, the first year cost is probably somewhere around $10,000. So very few people can actually afford this. But those who do and those who continue with the program, results are dramatic. So notice something very essential. Those of you who are familiar with genetics of Alzheimer's, the feared ApoE4 patients tend to respond dramatically better. So in patients who have improved, 3/4 of those had ApoE4, and those are the easiest ones to treat. At this point, I say that if the patient is compliant with protocol, it's nearly 100% assurance that they're going to resolve their Alzheimer's disease. just give an overall picture that we're observing, as well as the clinical trial that was recently published. This is some of our selected cases. The key aspect of the 90-year-old patient case is that even at 90-year-olds, recovery is possible as long as patient presents relatively early in the disease. So 23 out of 30 would be considered mild case. This is the patient who had a lot more complex situation with main drivers. So there was not just mercury, as is with older patient here, but with mold, mercury toxicity, and others. This case of 91-year-old patient was published. If you're interested, I will be posting the video on YouTube, and the links to this case will be in there. And also, if you're just interested, if you're physically present today, of course, I'll be happy to post the link to the study in the chat when we get to Q&A. And with that, I'm going to stop this is the end of my slides. What I'm going to do now is I'm going to talk to you a little bit about our team. Then I'm going to show you couple additional pieces that are kind of making, I think, our program very unique. And also I'm going to show you I'm not going to discuss in detail the ongoing randomized control trial that is done by Dale Bredesen. Instead, what I'll do is I will post a link to the actual website of the study. With Dr. Bredesen permission, he actually suggested for me to say a few words that the study is aggressively recruiting. Unfortunately, there is no site on the East Coast. That had to do with the complexity of how the study was set up. We were not invited to be one of the clinical sites for the controlled randomized study, but it is an NIH-sponsored trial. So in about maybe 2 to 3 years, we should have an actual really clear answer in control fashion that will be a lot harder for the industry and for medical establishment to deny. We do expect results to be dramatically positive. So with that, in no particular order, and I apologize if it's because I'm just going to look at the screen, and whoever comes up first from our team, I'm going to introduce them, and then we're going to have them each talk for a few minutes. So Dr. Yekel, Jana, if you may want to unmute yourself just for a sec, say hi. We'll come back to you. Dr. Yekel is our toxicity expert, mold expert. He is chiropractor by training, and through his own journey of health and illness, he came to realization of importance of mold toxicity, and now that's what he does, and not just for our program, but in general for our practice, since it's such a huge problem, especially not just in our area, but in the entire country. Jonah, do you want to just say hi?
Yeah, certainly. Thanks for having me today, and welcome to everybody who's showing up. I'm looking forward to sharing a little bit about mold toxicity when I get the opportunity.
Great. And next is Sally Novak, who is a therapist, lots of experience with trauma. Sally has some also personal story that's related to Alzheimer's. I'm not sure if she would be sharing this with us today. We don't have a lot of time. And she is offering kind of psychological support at the unfortunately, patients who go and the families who go through this disease suffer tremendously from complexity of shifts, from crisis of meaning, from depression and anxiety that settles. So it's essential to have a therapist on the team. So Sally, I don't know if you want to say hi.
I do. Hi, everybody. I'm looking forward to sharing with you a little bit about how I work in the team and the importance of managing our stress, which goes along with this process.
Great. And with that, it's not necessarily a part of the program, but we do have mindfulness-based stress reduction program. And I'm going to invite Nina Pohl, who's one of our teachers, to unmute herself and just say hi. And also, Nina, this is probably a great time to just say when this next MBSR is, and just in a word or two what MBSR is.
Yeah. Hi, everyone. It's great to be here. And I'm excited to announce that the next 8-week mindfulness-based stress reduction program will run on September 17th, and it will run for 8 Sunday afternoon classes. So Sundays from 2 to 4:30, great day to prepare your work week, maybe with stress management. And MBSR in a nutshell is considered the gold standard of mindfulness programs for stress reduction in the medical field because it is evidence-based, very well researched, and benefits include stress management for psychological conditions like anxiety, depression, and also for chronic health conditions. The stress comes with diseases like COVID or whatever you may be struggling with, and also you learn how to manage everyday stressors much better. And so each class is composed of 3 parts. So essentially, one part will consist of the mindfulness meditations, which include movement practices like yoga and mindful walking, the sitting and lying down meditations, and compassion meditations, and then everyday life activities like eating and walking are included. Another part consists of the didactic material. So each class has a stress reduction theme where you'll talk about with the instructor the mindful approach to things like difficult emotions and ruminative thoughts, and how to build a mindfulness practice into your day. And then last part is the group, just the group connection. So I'm kind of going on and on. I'm sorry.
Just the point here that MBSR is not part of the ReCODE program. We do recommend it for caregivers, but for patients, we don't recommend to join this because it's too structured, too complex. And unfortunately, when patients have a particular progressed memory problems, it's kind of difficult to follow with a group when patients don't have that. So we welcome some patients, but we would want to screen for that and making sure that the patients are a good fit for the program. So next is Dr. Ledinak, who is our local hormonal expert. A very significant proportion of patients with Alzheimer's will have a whole slew of hormonal problems, and actually, Dale recommends strongly that each practice that engages with ReCODE has a special bioidentical replacement therapist or physician, because it's the topic in itself so complicated that one provider is probably not able to do all of this, especially since it's for both, for men and for the women. So Marianne, Dr. Ledinak, if you want to unmute yourself and just say hi for us.
Yes, hi everyone. Welcome, and I'm happy to be here and talk to you about hormones and brain health and what I do.
Great, thank you. And the last person, who's probably the most important person for the whole program, is Brianna Darling, who's our program coordinator, health coach, and nutritionist. And Brianna, just say hi. Each of you guys will have 5 minutes to present your topic.
Hello, everyone. My name is Brianna. I am the nutritionist on staff, and I look forward to hearing more about all of y'all and telling you about this program.
Great, thank you, Brianna. So before I start handing it over to our practitioners one at a time, I do want to give you a kind of a preview for a couple of things. As I mentioned, I will put the link to the ongoing trial in the chat and a few other things in there as we start having our practitioners present. But there are 2 particular large pieces that we are quite fond of. So one, we're just about to start a randomized control trial on looking at the effect of microbiome on the brain. So this is an industry-sponsored large study for close to 100 patients in a randomized fashion. Everybody will get a free comprehensive stool assessment for microbiome, followed by adjustment of the diet and potentially probiotics, and we will assess how patients' brain function response. All patients who are going to be invited to join the study will have to have a minimal cognitive impairment or early Alzheimer's disease. We're not going to have kind of normal controls, but then some of the patients will get the stool and will not have any suggestions in terms of diet adjustments, while others will. And then we'll simply kind of see what the results of that will be. And the second is, as I promised, the 40 Hertz light, sound and sound therapy study just got published. We're seeing very good results. What I'll do is I'll put the link to the study in the chat as well. And We are looking for large control trial now that we have pilot studies showing strong benefit. The plan is to obtain an NIH grant and do a large trial. We are using free existing technology. If you have an iPad or iPhone Pro, you immediately can download the app called alz.life. Again, all of this I will post. You don't have to look for it now. I just rather you listen to all of us for the whole time and then look for this. And the app is free. There is no, at the moment, there is no plans on making it cost anything, just because the technology that's in use here is already on the market. This is in comparison to several FDA-approved devices that are already in use, but they're currently not available for non-research use, and the expected prices are going to be very high. There are a slew of non-FDA-approved equipment out there, which I highly discourage people from using, since we don't know anything about those devices. And our device is just started to undergo FDA approval. Usually takes about 12 to 24 months. So with that, I am going to pass first on, and I apologize, you guys, if I going off a little bit in sequence. So let's start with Sally Novak and hear about importance of stress reduction, importance of meaning, and importance of understanding one's own journey.
Well, thank you, Misha. So I would start by saying that for all of us as we age, but particularly for individuals who may be predisposed to developing Alzheimer's, managing stress is particularly crucial, as cognitive function may already be vulnerable in these individuals. Change is stressful, even when we are choosing to make changes to improve our health and quality of life. We often need help and support to make those changes and to overcome the obstacles that arise. And that I see as being my role in the ReCODE program. I'm sort of the emotional support arm. Sometimes my work involves stress management, but it takes various forms. I think for everyone in the program, how we manage stress may look different. So sometimes my work involves helping people learn new techniques to better cope, like meditation or mindfulness skills. Sometimes it's finding new ways to communicate with our family and support team so that we can work together towards common desired outcomes. Sometimes it's as simple as helping clients set priorities, develop a routine. And then I would say that something Misha mentioned that I think is very, very important is the importance of sleep in this program. And not only are we doing testing to see if people have sleep apnea and these kind of things, but I can also help in that regard, as I'm CBTI and CBT for insomnia trained, and I can help clients with sleep hygiene. Chronic stress is really, really bad for our memory. I don't want to insult anyone's intelligence here. I'm not sure what my audience consists of, but chronic stress impacts the hippocampus in our brain, which is the part of our brain that's responsible for creating new memories. And it's also the part that is first impacted by Alzheimer's. Chronic stress, this staying in a fight or flight response, causes this part of our brain to shrink and impacts our ability to form new memories. And that's why we want to do things like yoga, meditation, being with people. All of these have been shown to restore our cortisol levels and restore the size of our hippocampus. So that's part of my role. There's a lot of room for question, I'm sure. I do think that I try to reframe the experience of being a part of whatever challenges people come to as an opportunity for growth. And by virtue of their involvement with me, with Brianna, with Misha, they're learning new things. And this is also restorative and protective. So I'm happy to answer any specific questions people have.
Thank you, Sally, so much. Let's go to Dr. Yeager to hear a little bit about sort of the critical value of mold toxicity and how we treat it, and also just what we're observing between the relationship between Alzheimer's and mold.
Yeah, thanks, Dr. Kogan. And again, welcome to everybody. I'm going to spend a few minutes talking about an incredibly complex and very intensive recovery, quite frankly, but chronic inflammatory response syndrome, probably one of the most common illnesses that most people have actually never heard of. And chronic inflammatory response syndrome, or CIRS, is associated with biotoxin. So biotoxin is anything that a toxin that comes from a living source. So this would include mold, but it also includes bacteria. So if you've ever heard of anybody with chronic Lyme disease, what they likely actually have is chronic inflammatory response syndrome. And we're now actually learning that it also is even triggered by viruses. So, maybe you've heard of Epstein-Barr syndrome, herpes can be a trigger, but of course the big one nowadays is COVID. So when we're talking about people with long COVID, oftentimes what they actually have going on is chronic inflammatory response syndrome. And this is an underlying inflammatory response that occurs in about 25% of the population is estimated to have a genetic predisposition to not be able to detoxify these toxins appropriately. So it doesn't affect everybody in the same way. But so if somebody has an exposure to mold, for instance, 70% of the population is going to detoxify those mold toxins just fine. The other 30%, not so much. But what we've found is that this inflammatory response, what's oftentimes referred to as a cytokine storm because it's associated with the immune system, it literally inflames the brain. And so Richie Shoemaker actually put this on the map and has developed a protocol for helping people recover from mold-related illness, Lyme, long COVID, but essentially chronic inflammatory response syndrome. And this body of work ultimately emerged parallel to the work that Dr. Bredesen was doing. So it's kind of its own body of work, and it's incredibly intensive, and it comes in stages. So it requires one, removal from exposure. So obviously if someone is in mold, well, we have to get them out of mold, or they have to remediate their home. So right there, that's a huge piece. And as Dr. Kogan was talking about expenses, this is an incredibly expensive recovery for a lot of people if they have to sell their home, if they have to get rid of their stuff, but their brain may absolutely depend on it. So the recovery is removing people from exposure. It's detoxifying the body from the biotoxins, again, whether it's mold, whether it's bacteria from Lyme, whether it's toxins as a result of a viral infection like COVID, so detoxifying the body, and then shutting down that inflammation that is causing the damage to the brain, and then finally healing those tissues that have been damaged. And for probably 15 or 20 years, we've actually known that the brain damage is a very significant side effect. And oftentimes this is minimized because a lot of people with chronic Lyme or mold related illness just kind of refer to it as brain fog, when in fact what's really happening is these are early indications of dementia. The brain is actually inflamed and the brain is actually atrophying, and we can see these on MRIs, and we can actually even recognize on the MRIs patterns that would be consistent with, say, mold-related illness versus someone who's got Lyme versus someone who maybe has a head injury or something else. So we can recognize with very advanced imaging, we can actually recognize the root cause potentially of what is inflaming the brain. And then somewhere, I think it was maybe around 2015 or 16, Dale Bredesen became aware of the work that Richie Shoemaker was doing, and he actually even published a paper called Inhalation Alzheimer's, because they were now recognizing chronic inflammatory response syndrome, mold-related illness, Lyme, and now we can add COVID to the bucket as an actual potential root cause for dementia and Alzheimer's. And I think this falls under type 3 of the on the Bredesen protocol under toxicity. And I think that there's good news, bad news. The recovery is long, it's intensive, it requires lots of follow-ups. It can be very expensive, and we do see people completely recover and completely heal and repair their brains on pre and post MRIs. And right now the key here, and this isn't as simple as just putting people on this, but we're using a peptide called vasoactive intestinal polypeptide. It's a nasal spray. And a peptide is a precursor to amino acids. So it's a compounded, but it's not essentially really a drug. It has really no known side effects. But once we get people out of exposure, once we detoxify their body, we can use VIP to shut down the brain inflammation And we actually, there have been studies now that show that it rebuilds and repairs damaged tissue that's occurred in the brain. So, I mean, it's incredibly promising. It's really exciting to see people going from very, very chronically ill for years and sometimes decades, getting their brain back, getting their life back, and fully recovering and being able to move on with their life. So that's the piece of the puzzle that I bring to the table for ReCODE. I specialize. I've trained personally and professionally with Richie Shoemaker, and I pretty much do this all day, every day. So if you enter in the program and it turns out that mold is potentially playing a root cause in your inflammation and brain issues, well, we'll probably get an opportunity to work with each other. So Dr. Cohen, thanks for having me on, and hope everybody enjoys the rest of the program. Yeah,
so I thank you, Dr. Ekeley. The peptides is definitely the future. Some of you probably already been familiar with some. We're beginning to use them, and we have seen some pretty profound results with use of VIP, but it does take a lot of time. So thank you. And I am posting some links, and actually I just posted the link to the study that Dr. Ekeley mentioned on inhalation Alzheimer's, written by Dr. Bredesen. So let's hear from Dr. Ledinak about the value of hormones and how do we treat, and sort of what are the practicalities of addressing hormonal deficiency, particularly in women.
Okay, hello everyone. So I guess I'm the hormone expert here. So one thing that I want to just say, as some of you may or may not know, that the brain is actually full of estrogen receptors, and it's actually tremendously dense with estrogen receptors, especially the part of the brain that tends to deteriorate in Alzheimer's and cognitive issues. So estrogen has a tremendous impact in brain health overall. And I know the problem is that, a lot of people will look at all the research out there and say, wow, there's so much that says hormones are bad. Other stuff says, other research shows hormones are good, right? And a lot of that has to go back to the Women's Health Initiative, which changed everything in 2002, which some of it was right, but some of it was very, very wrong. And they've since revised multiple times, their review or assessment of that. So the key thing is the way, and it can feel sometimes really complicated, but the key thing is which hormone you choose and how you choose to deliver it, which is really important. And so the way I look at all hormones, but particularly when we're talking about estrogen, which is one of the key ones, I use what's called estradiol, which is the natural or bioidentical estrogen, right? And instead of a lot of the studies that showed that hormones were bad, they used what's called synthetic hormones. So they use conjugated estrogens, typically Premarin, or medroxyprogesterone, which was typically called Provera. And those, and that's why a lot of the bad effects of hormones came from. So we use, in terms of hormone replacement, is estradiol. Either we use that as a cream, so it's topical, it's transdermal, it's either a cream or a patch. Both are really, really good. And then of course we always want to balance that off with progesterone. And typically we use oral progesterone, and it's what we call the real or original progesterone, which is a bioidentical progesterone. So we only use bioidentical hormones in terms of treatment. And in terms of, when I see a patient for hormones, I will take a, thorough history, making sure we want to make sure there's no history of cancer or things that might, increase the risk down the road. I do mainly by serum or blood test evaluation of hormones. We also use urinary metabolites testing to look at how your body is processing the hormones to make sure they're going down the right pathways. So this is how I initially assess, and also how we monitor. And we replace typically all the hormones. So I look at everything from DHEA, which is out there known in the world as your anti-aging hormone. We look at testosterone, we look at estrogen, we look at progesterone, and pregnenolone as well. We do that as well. So yeah, I guess that kind of summarizes, what I do. And it's a very complicated sort of arena, but I'm trying to summarize it in a short way.
Thank you, Dr. Ledinak. I do want to say that not everybody who have hormonal deficiencies and who have cognitive decline will have to get hormones. It's a lot more complicated. That's why we have a whole team, and Dr. Ledinak being kind of in charge of that aspect. Depends on your risk of certain cancers. It depends on at what point you became menopausal. So it's very complicated, but what it seems to be very clear is that the women who are started on hormonal replacement immediately after menopause have the best outcomes, and the data seems to be quite consistent to the point where quite recently there was a JAMA article kind of confirming, even though the article that I just posted in the link in the chat has the largest study today showing the benefit of replacement in a very large cohort of patients and hundreds of thousands of women. So,
oh, yes, I just wanted to add, so yeah, the timing issue, right? They say that that's a really important, that the sooner you start, of course, the better. However, if you're generally the window that's used is within the 10 years of menopause, but there's a lot of patients who are maybe like hit menopause at 50 and at 65, they're realizing they have cognitive issues or maybe even other like, you know, bone density issues and things like that. So we would still, it actually now, especially according to the North American Menopause Society, the way the statement they put out in 2017, now we would still start those patients on hormones, especially if they have, you know, the ApoE4 and significant cognitive issues, but just with a little more caution and monitoring and, you know, explaining more the risks and benefits.
So thank you, Dr. Lednak. And let's hear from Brianna. And I think I have forgotten to spotlight each speaker. So if you didn't see them, I apologize. But if you did it on your own screen, that should have been fine. So Brianna's going to bring us to a close over a couple of minutes, just talking about the value of following all the pieces of the program and sort of why we have to have a coach, why we have to have a program coordinator.
So I wanted to thank Dr. Yekel, Dr. Ledenek, Dr. Novak, and Nina to greatly bring their expertise to this program. Without that, I would not be able to do what I do, which is coach and lead the patients through this very complicated protocol. So I coordinate this program. I meet with each interested party 1 hour a month at minimum. If you wish to break that 1 hour into half an hour every couple of weeks, that's also fine. This is complicated. I make it my priority to meet the patient where they are at. It's a balance between the diet and fasting portion. We go into a lot of description and balance of dealing with a diet, whether that be the keto flex diet or the Mediterranean style diet. Concurrent fasting of minimum of 12 hours of fasting from the time you finish your dinner to when you next have your meal the next day. And we go a lot more over details about that when we meet. We also deal with regulating physical activity, whether that be light or moderate exercise. Light or moderate cognitive exercise is also a very important component of this program. Either daily light therapy sessions or up to like an hour minimum, or it could be online games, it could be jigsaw puzzles. Once again, your lifestyle comes into a great play of how I manage this program with you. It's a difficult program and protocol, but there are elements of it that can wiggle, and we can meet you where you're at within reason. And throughout the diet fasting portion, the physical activity, and the cognitive exercise, there are also very frequent cognitive assessments that we have you doing, whether that be the Montreal Cognitive Assessment, the MOCA, whether that is the self-administered BOCA, which is Boston Cognitive Assessment. And through a online portal, we also have you do something called CNS vital signs. All of this has to be done at regular intervals, which I then go into more detail upon us meeting. But all of this comprehensive protocol is complicated. I am very happy to help guide you by the hand through this step by step, breaking it into very small spaces. So it is at least overwhelming as possible. Now with the diet portion, because the diet portion can be overwhelming, you may have a lot of financial issues coming over to the new diet, time management. Apollo and the Bredesen program just came forward with a new Apollo meal plan, like that is mailed to you, like meal plan that is pre-prepared type thing, that is 100% compliant with either the Keto Flex or with the Keto Flex diet. And if you can't tolerate the Keto Flex diet, it can be adjusted a little bit to still be with the Mediterranean style diet. But once again, this is a diet that I implement, meeting you where you're at while being, meeting you where you're at while compliant with the actual protocol. It is imperative to follow this full protocol, and we'll see what we can do. But I'm confident that between me, Dr. Kogan, Dr. Ledenek, Dr. Novak, and Nina, and Dr. Yakel, we can absolutely help you with your situation.
Thank
So,
you, Brianna. Thank you.
welcome to the program.
Thank you. Welcome to the program. So I just want to highlight a couple of points that Brianna so elegantly described. And I think the main one is really the fact that unfortunately, due to the complexity of a program, we only accept people who have caregivers, or who are currently at a point in their cognitive decline that can handle the program themselves. Because the program is so complicated, and even with all of our assistance, we're not going to be with you for 4, 5, 6 hours a week. It's just physically, financially impossible. In a clinical trial, that's the amount of time that patients are getting. They're getting 4 to 6 hours of coaching per week. That would cost exuberant amount of money by any standard, unless you're in the clinical trial. So we require that amount of time is spent by a family for the patient. And the general adjustment of total hours a day needed to follow and comply with the program is about 2 to 3 hours a day. So it's a major, major undertaking. This is not something that the healthcare system has any clue how to administer. It's just not set up for that level of complexity of management. It's probably the most complex clinical program we have, a lot more complicated than any cancer approach, is a lot more complicated than any other existing conditions, but you have seen the results when somebody does able to follow through with the program. So I think with that, it's a very good time to switch to questions. And if you're comfortable unmuting and coming on, you can raise your hand and we'll have you speak your question. Otherwise, of course, put the questions in the chat. I'll moderate this portion, and we'll see whoever's going to answer will be the best person for a particular question, and it may also be more than one person will be answering them. So Linda has a first question. Thank you so much. For existing GWCIM patients, how much of ReCODE can be done virtually? 100%. This is one situation where this program can be administered 100% virtually. All of our assessments, all of our tests currently can be done virtual. It's a bit more complicated because as we didn't actually discuss this, but the frequency of blood work required in the program is anywhere between every 3 to 4 months. So 3 to 4 times a year, there has a very complex over 200 points of lab assessment that has to be done to make sure that all the risk factors have been optimized. So if you live in an area where getting some of this tests may be challenging, that may represent some issue, but usually we're able to order and coordinate with you. So thank you so much for this good question. Dr. Mintz, thank you, Matt, for joining us. Dr. Mintz is one of the very well-known local physicians who has a functional medicine practice just close to us. He's also an expert in medical cannabis. So Matt, so glad you're here. So he's asking for Dr. Ledenek. We know that bioidentical hormonal replacement earlier is better. Is there any age that you would not start BHRT? And you mentioned closely monitoring in older patients. What are you monitoring? Thank you for this great question.
Okay, thank you. That's a great question. So, I mean, I don't know. I may not start it in someone over 90, but I guess it's a tough question, because the sooner you start, the sooner the benefits, especially in terms of the vascular benefits and so forth. But yeah, if someone is in like 70 and, you know, like they're at high risk or already in cognitive decline, and there's no history, either personal history or immediate family history of cancers, I would still consider starting them if we think that there's a huge benefit in terms of the cognitive portion. And yes, in terms of closely monitoring, basically, you know, they also, I don't use oral progesterone, so there's much less of a chance of, you know, the cardiovascular risks like blood clots, stroke, and things like that. But I would still probably look at their CRP inflammation marker. I would look at fibrinogen just from the clotting perspective. But other than that, just monitoring their serum levels, making sure there's no actually data showing what numbers we're looking for, but generally in the hormone world for cognitive issues, we know where we'd like estradiol, we know where we'd like, you know, progesterone generally to be around. But yeah, does that sort of, I don't know if I answer the question fully.
Matt, I think I want to add something real quick for this. Yeah, so the Dale in his ReCODE 2 training has this kind of a windows that are suggested, which we try to follow. But you can also think of it in a more of a kind of a broader way. It's kind of, we try to basically get it to the optimal level in the 30s and 40s. That's thought to be kind of how you would handle this. And again, as Dr. Ledinak pointed out, we don't use oral anything because of the concern of things going through the liver. So everything is administered usually topically, right, Mariana? Most of it.
Yeah, topically, and just on the oral on the oral estrogen, the key and all the studies showed where the patient was more at risk for blood clots, you know, or stroke was only in the women that were over 65, not under 65. However, in general, I know in Europe they use oral progesterone primarily and a lot, but here in the US and generally North America, we just use mostly, well, I use only topical estradiol, not any estrogen, just estradiol.
Great, thank you so much. Next question is for Dr. Yekel. Don is wondering if what kind of mold testing you do, and do you test both home and the body? And I know you have strong opinions about that, and we can actually have a whole hour discussion about how to do this, but I'll have you answer that instead of putting my opinion.
Yeah, there's absolutely some different opinions out there, but I will say that the gold standard, and when I say gold standard, I really mean just like what has been validated by research, is that there is a set of blood panels. So there's a blood panel that we run that will evaluate for an inflammatory response. As well as the, you know, one, we look for the genetic component. Is someone genetically susceptible to begin with? Two, do we witness the inflammatory response that occurs when people with the genetic predisposition are exposed to biotoxins such as mold? And then three, is it having the downstream cascading effect on the hormones, mostly hormones that Dr. Ledinak is not talking about, hormones most people haven't ever heard of, like melanocyte stimulating hormone, which is a brain hormone that impacts all kinds of different parts of our health. So there is very specific labs. Yeah, there's a lot of controversy over urinary mycotoxin tests. What does it actually reveal? What does it actually tell us? Is it actually, you know, a valid way of assessing? People are on the fence. I know Richie Shoemaker says no waste, don't waste your money, get the blood work. So the blood work is the gold standard. And then as far as testing a home, you know, again, this is very complicated, but our starting place for most people is using a company called EnviroBiomics. They do an at-home Swiffer test called an ERMI, E-R-M-I, and they'll just go around their home. And, you know, usually if I'm working with people, I'll walk them through this process. Well, here's where you Swift, here's how you do it, so we get adequate results. But yeah, so it's like we need to know, do you have the physiological symptoms consistent with mold-related illness, chronic inflammatory response syndrome? And then if so, are you currently being exposed because that will prevent you from getting better. But keep in mind, it's really important to recognize that people can actually have chronic inflammatory response syndrome from a past exposure. So an old home, like somewhere they used to live or work, made them sick, and now maybe they're in a clean house, but they're actually still sick and potentially even getting worse because the inflammatory reaction was never shut down. So absolutely, we have very specific guidelines on how we test both the body and the home or the work. And it's incredibly important to get these right. Otherwise, yeah, we'll set ourselves up for a little bit of self-sabotage, and people won't recover if we make mistakes in the process.
Great, and thank you for mentioning the EnviroBiomics. I put their link in there. I actually put the kind of a simpler, lower cost test, but there are actually different tests that you would need to meet with Dr. Yekel if you're interested in figuring out which test is best for your particular situation. Nina Pola reminds me to mention that in addition to the MBSR class, we also have her and Cynthia Powell do an individual consult. So if you don't want to be in a group, or if you're interested in mindfulness for you and the whole family, that can also be done on individual basis. Nina, primarily virtual, right? I mean, most of it nowadays done virtually.
Yeah, it's the choice of the individual. In person is also available.
Yeah, so I actually want to kind of highlight this whole point here. There are at this point hundreds of Bredesen sites or Bredesen or ReCODE certified practitioners in the country. And if you're not local to the DC area, there is something to be said to have a value of having your practitioner close to you. And there are more than one reason, and it's not just getting the lab tests organized, but generally for reimbursement reasons, for having other parts of the follow-up. So, for example, we require that all of our patients connected to a memory clinic of some sort. I mean, we don't really require it. If you don't have it, we will suggest one, and we can work with someone even if they're not in such a program, whether it's through the neurology or geriatrics or some other service. But usually we would ask our patients who are local to then enter the George Washington University Memory Clinic, which we have several clinical and research and educational projects together. And since several of us are on faculty at GW, we kind of coordinate this work with them. But if you don't live in our catchment area, in DMV area, and you live elsewhere, then of course, this is going to present a challenge because a lot of academic programs will not take the patients out of state, even though pandemic has changed that, and a lot of places do offer variety of different outpatient options. Like, for example, our practice is obtaining compact license right now, which will allow us to see patients in 30 states. But some practices choose not to do that. And so they kind of require you to go to the physical location of the practice. So that will represent significant challenge if you're not immediately in the area that has a Bredesen center. But of course, I'm going to put in a second also the main Apollo website into the link. And this is where you can find the centers, this is where you can call to find out about anything else you have question-wise in terms of how the program is operated. Now, if you don't have any medical problem, and I forgot to mention that, and if your memory is perfectly fine, but you have concern for the future, let me give you some examples. For example, you have a feared Alzheimer's gene, an ApoE4, and you're worried that in the future, you may be perfectly fine now, but in 10, 15, 20 years, you will get Alzheimer's. So this is actually, I feel strongly, the best program for you. The PreCODE, so Prevention of Cognitive Decline program, is the one that I would recommend. And you can look up more details at the main Apollo website. I'm putting the links in as I speak. So there is one, that's a general link, and also the PreCODE program link I'm going to put in. And of course, you can also talk to us. You can review our program in more detail online, which I'm going to post the link to. And we still have time for maybe a couple more questions. So if anyone has more questions, or if you prefer to unmute and talk about your question verbally, please, by all means. But for now, I don't see any additional questions. I'm surprised that nobody asked about pricing and nobody asked about sort of frequency of visit and all the kind of logistics. Don't be afraid. I mean, I think it is critical to understand that the program is not cheap, and not just because you have to see us. I mean, I think significant portion of the cost simply goes from the fact that you're going to have lots of visits and somehow they have to be paid for. But also, you know, change to a better diet often comes with a price tag. The vitamins come with a price tag. And, you know, other things come with certain price tag. I did mention that probably in the first year, one of the most expensive parts of the program is the dental work. I didn't discuss that in detail, but we do send patients to biologic dentists. We usually do not allow removal of silver fillings containing mercury by regular dentists because you have a massive exposure to mercury during that process unless the fillings are removed safely. So that's a very, very important part of that. And also, since we're on this pragmatic aspect, we do try to have whatever we can pass through insurances, including Medicare. And so the way we do this, we would use imaging, we would try to use some blood work. We can't do all of the blood work straight through Medicare because we find that often it is not covered service for certain labs, but Apollo has created a packaged price for Medicare patients. But if you don't have Medicare, usually insurances will pay for all the lab tests that are directly related to the program, although functional medicine labs are often not covered. Specific protocol of exercise, and Nina's asking congenital questions. So, you know, it's actually quite, maybe Brianna is better answering this, but I'll just say a couple of words on my own. It's really individualized because not everybody's the same. I personally prefer for most patients to combine memory training and physical activity. So that would be more like maybe a Tai Chi or yoga or something where your brain has to think about next movement, like a dancing would be really good. But Brianna, I'm sure, has her own ideas how to what to say too.
Absolutely. Absolutely. So as Dr. Kogan just mentioned, it's highly personalized. A lot of it has to deal with your level of mobility at whatever happened to age you happen to be at. I have current clients that I'm dealing with. They range from marathon runners to people who have had significant hip surgeries, significant knee surgeries, bilateral knee surgeries, that kind of thing. So the target is to move some way every day, whether that may be light to moderate intensity, whether that could be just physical activity like, oh, hey, gardening, or walking while you're listening to some light or sound therapy, or going on the treadmill if the weather is not permitting. There's wiggle room in this protocol depending on your actual lifestyle. And it also has to deal with your hobbies and habits too. So the physical exercise portion and strength training absolutely is a little bit more flexible, particularly. Yeah.
Brianna, is probably the most flexible part of the program, right?
Absolutely, yes.
Yeah, because the cognitive, the thing with the cognitive training, you know, the Apollo provides at no cost Brain HQ. So if you're joining the program with the monthly dues, then that's folded in the price. I think Brain HQ alone is like probably $15 or $20 a month. So it's not that cheap if you get a professional level. If you get the basic level, it's pretty restrictive. But a lot of people don't even like that. So, you know, even cognitive has some adjustment.
Yeah, like crossword puzzles, jigsaw puzzles, that kind of thing. If you have grandchildren, even you can play with grandchildren even a little bit, can deal with physical activity and cognitive exercise. But it's just activity, regular activity for the most of the day.
You know, and like when we say cognitive, we don't necessarily mean you have to sort of develop some exactly new cognitive skills. I mean, that cognitive engagement can be very broad. The only thing we usually try to tell everybody, it has to be challenging. Like you don't want to do something you're super good at and you've been doing it for a long time. You have to challenge yourself to some new level. So certain things, if they can be progressive, like Brain HQ, or that's actually why I love so much certain, I guess we call it martial arts techniques, where there's always a progression. You don't stop at a particular level. Or with dancing, you know, dancing can be very progressive. So, but lots of different choices. Well, I think we're at the hour. I hope this was useful for everybody. Again, all of these links that I've posted, we'll make sure that they also posted in the YouTube video when it gets put there as a recording in the next couple of days. So if you missed any component, please check it out. Or if you also have questions for us, or if you just need to get in touch with us, I'm going to post our general website and our general phone number. And I hope everybody has a wonderful hot weekend here in DMV area. Stay cool. And we'll see you soon on our next virtual house. Thank you so much for participating.